When I was running for office 2 years ago, almost everyone said we need to reform our healthcare system. People have been denied healthcare coverage because of a pre-existing condition. Women and children were denied healthcare coverage because they got sick and suddenly their health coverage was removed. Individuals stayed with a job simply because of the health insurance benefit when maybe they had a better job offer for what they're actually trained to do. With healthcare reform, what we wanted to do was, what we did do with the piece of legislation, is we actually made sure that people in our nation have the security of having the opportunity to have coverage at the times when they need it. So this piece of legislation will do a few different things. First of all, it will take away the very egregious practices of the health insurance companies in terms of denying people coverage, throwing people off their insurance when they get sick, and the high cost of premiums going up, particularly when you do get sick. And what it's going to do is provide that freedom that people need. Think of the person who has a great idea for a new business. They want to start that business, but they've got a family at home and maybe one of their children has a pre-existing condition such as diabetes. They cannot go out under the previous system and start that business and get their family insured, particularly with a child that has a pre-existing condition, unless they pay a very, very high premium rate, something that would most likely be unaffordable for them. Also, many people, hardworking people, who've gotten sick under no fault of their own. For example, they might have gotten cancer, lost their job, lost their ability to be insured because of that job, and then end up going bankrupt simply because they got sick. So as we move forward with the healthcare reform implementation, I think what the American people will find is that they have better security, that we're going to be able to take care of those who are certainly less fortunate than I am in terms of their health, and that we're going to be able to have a fairness in our healthcare system. And beyond that, we're also going to help to control the costs of healthcare. The system as we have today is unsustainable in terms of the cost of healthcare. We spend 17% of our GDP, our gross domestic product, on healthcare. The next closest country spends 11.5%. And so there's many pieces to the healthcare reform that are going to look at implementing new ways to have a more efficient system, a system that will be hopefully better for all in terms of communication with health information technology, for example. If I go to one doctor and I get a test, I don't need to get the test retaken at a second doctor. That's overuse of the system. But with hopefully the health information technology that we're implementing in this piece of legislation, you'll actually only have to take the test once. And that will help cut the cost as more and more people do that. So there's just a lot of pieces to this health care reform that will help us control the cost. And one big part of that is the preventative side. What we want to do is start treating wellness and not just treat illness in this country. We want to help people take better care of themselves so that they can live a better quality of life. And so what we want to do is encourage that wellness. People are going to be able to go to the doctor for a well visit, go get their blood pressure checked, their blood sugar checked, go in for a colonoscopy or a mammogram as their doctors recommend that they do. And then find out early if they have any problems so that the problem can be treated at a stage where it costs very little versus waiting until the problem has gone on for so long that they end up in the emergency room in with a serious illness. So there's many, as I said, individuals in this country who have for a long time been without any coverage, who have not been able to go and just even get a well visit. And we want to make sure that that changes. So as we move forward, there will be a lot of questions. I recommend that people go on the new website, healthcare.gov, where you can find a lot of answers to the healthcare reform bill, and in terms of the timetable as to how it's being rolled out, and also just questions whether you're a small business owner, whether you're an individual without insurance, a senior citizen. The answers to many of your questions can be found there.